Hello, we're the Ukweli test strip venture. Treatable diseases often go undetected in sub-Saharan Africa for a variety of reasons, one of these being that in countries like Sierra Leone, the general population outnumbers physicians about 50,000 to 1. In comparison, in the United States, this number is only about 500 to 1. Because of this lack of physicians, the average individual must travel up to 53 miles to seek medical attention, sacrificing work time and wages, which is an issue when that same individual only makes about $3 per day. This affects people like John, a rural farmer who, after not originally seeking medical attention at the onset of diabetes, eventually lost his vision, a foot, and consequently his job as the disease progressed. Our solution to this is Ukweli test strips. These test strips are screening devices used to screen for a variety of diseases in countries like Sierra Leone, and these strips are simple, affordable, and accessible. These strips are simple in that our 2-parameter test strips screen for a specific disease as opposed to 10-parameter alternatives, and affordable in that our strips cost less than an eighth of the alternatives at 20 cents as opposed to $1.75.
So how do we make our strip accessible? With the cooperation with local organizations such as World Hope International, we will be able to manufacture our strips. Next, the local clinic and the CHW will be our 2 channels to distribute these strips. These strips will be provided at the clinic and carried with the CHWs. The CHW will then carry these strips, walk door to door, and ask if the patient is willing to get screened. If the patient agrees, the CHW will hand them a cup and allow them to go to their bathroom to collect their urine sample. After they come back, the CHW will simply dip the strip into the cup, and after 30 seconds, if there is no color change, that's good. However, if there is an obvious color change indicating the presence of diabetes, the patient will be further referred to a local clinic to receive additional health care. In terms of our value proposition, we provide the CHWs and the clinic the chance to make a bigger impact in their community and also allow them to always have test strips and generate their own income by providing these strips. We provide individuals like John the chance to access these personal and customized screening test strips in the privacy of their homes.
Our venture will have 3 principal metrics of success: the number of test strips sold, the number of clinics that stock our test strips, and the number of patients who seek follow-up treatment. These measurements, which we've calculated for year 1 and year 5 of our venture, are based on the 10% and 90% of these specific demographics. For the number of patients in Sierra Leone who are liable to have diabetes, the number of clinics in Sierra Leone, as well as the larger population likely to be at risk for diabetes. As follows is the cost of goods sold for our test strips for 1 year of revenue. This specific cost will be $685, and we will be able to manufacture our test strips for 4 cents a piece. Because we can manufacture our test strips for just 4 cents a piece, we will be able to sell them to community health workers for just 10 cents, and thus they will be able to sell them to community members for just 20 cents.
So how do we manufacture these test strips? Our previous game plan relied on printing these test strips using a traditional inkjet printer, but this was unsuccessful because the printers were expensive, they clogged easily, and also required a high level of CHW training. We reworked our process and decided on stamping, which is a simple, low-cost, and versatile process. Literature reviews have shown that stamping is used in a variety of manufacturing processes, but its particular application in developing test strips has not yet been shown. Our first phase of experimentation involved identifying the optimal combination of stamp and substrate in order to best design these test strips. We tested several different substrates, including cardstock, paper towel, Teslin, filter paper, and printer paper. We also tested a variety of different stamps, including droppers, refillable markers, rubber blocks, foam, and 2 different types of self-inking hybrid stamps. All the stamps and substrates were chosen based on being easily accessible and affordable. Through the Materials Research Institute, we were able to perform a variety of different tests. Our first test involved validating the surface chemistry of these substrates. We did this through a basic pH test, and from this we were able to eliminate several of the substrates and stamps previously mentioned. To better hone in on the best substrate for this job, we first performed a liquid dispersion test, from which we were able to see that filter paper experiences more liquid dispersion than Teslin. We also performed a paper absorbency test, in which we saw filter paper absorbs almost 3 times as much liquid as Teslin. From this, we were able to identify filter paper as our best substrate. We also tested several different stamp types. This shows a test of stamp imprint consistency, which is important for reasons of quality control. From this, we were able to see that the foam stamp had the most consistent imprints, and thus was chosen as our stamp ensemble. So why is this technology unique? It is a platform technology that can be used to screen for a variety of other conditions, such as methanol levels in alcohol, water purity, pregnancy, urinary tract infections, and diabetes. Our current focus for Ukweli test strips is diabetes because it is a growing problem affecting many different nations.
To develop our diabetes test strips, we utilize two different parameters, a glucose and a ketone assay, which were proven to be the most successful and reliable indicators currently utilized by commercial test strips. To develop our glucose assay, we utilize a sigma-Aldrich protocol, and even though we utilize different chemistry, as we used chromogen choldodienizidine, we were able to obtain the same color change as currently commercialized test strips. To develop our ketone assay, we utilized a US patented protocol by Majors, and we were able to obtain the same sensitivity and specificity as test strips currently utilized in the United States.
Right now we are pending IRB approval for 2 studies on the ground in Sierra Leone. The first study involves interviewing individuals at different levels of the healthcare system to identify the different ways to detect and treat diabetes in Sierra Leone currently. Study 2 involves examining the community response to the integration of these test strips. We do this through 7 different pathways. The first 2 are having community health workers hold a meeting for the community where they announce Diabetes Day at the local clinic. The clinic will then do the screening, and there are 2 scenarios, one that is paid and one that is unpaid. The next 2 scenarios involve community health workers going door to door during their usual visits and offering these test strips to their patients. The 5th scenario is where pharmacists are able to sell these test strips to their customers. And the last 2 scenarios involve the clinics being able to advertise through word of mouth and through posters to have the screening done in-house. Right now, Ukweli test strips are in the process of growing. We are hiring a full-time consultant to work on the ground in Sierra Leone, as well as hiring a part-time researcher to develop the UTI test strips at Penn State this summer. This is all made possible through funds, including a VentureWell grant of $25,000. Right now, we are also finalists for Saving Lives at Birth grant, which is $250,000. Thank you for your time. Do you have any questions?
In Sierra Leone this summer, we're going to be accessing members of the community as well as professional clinics to determine the best way to disseminate our test strips to community members and to community health workers. Once we're back in State College, we're going to discuss our strategy with faculty members from the Smeal College of Business and determine how we can go from targeting 10% of our 3 demographics in year 1 of our venture to 90% in year 5. So as we can see here, there are approximately 700 health clinics in Sierra Leone. Of these, only 4 are hospitals. The rest are fairly disparate. So one of our primary challenges is definitely going to be figuring out how to effectively target this disparate health system and effectively distribute our product. So to reiterate, we can sell our test strips to community health workers for more than twice the price at which we manufacture them. And this will only increase with the economies of scale that we expect as we manufacture and sell more test strips. So even though we're starting our venture with a grant, we firmly believe that this is a product that can be sold on its own like any other commercial product.
In the first study in which we will identify the current pathways for diabetes, as diabetes is not the main priority right now in Sierra Leone, we think that for diabetes patients, the only way to receive treatment would be through hospitals. In examining the impact of our product on the local community, we think utilizing community health workers as a liaison to reach the community would be the best strategy.
Community health workers are well-respected members of their community, and they also develop a very close relationship with the community members that they serve. So the likelihood of them pressuring community members to purchase these test strips is highly unlikely.
Community health workers will undergo a 2-hour training session in which we will teach them how to read the test strips. Also, we will suggest to them to refer their patients to the local clinics if the test strips is not clearly negative. In addition, I would like to underline the fact that the test strips is not a diagnostic tool, but it is a screening device.
through testing, we've been able to validate that our test strips perform just as well as commercial test strips. And because of the chemistry of these strips, these tests tend towards false positives as opposed to false negatives, which is preferable because this means that more individuals will be seeking further medical attention as opposed to not seeking treatment for these diseases.
So the rural community usually don't have the access to hospitals, and the CHWs in these contexts usually are not permitted to do blood-related tests. So the safest and the simplest way is to use the urinary test strip because blood-related diseases are really common in these areas. We are testing glucose and ketones because these are the gold standard parameter that are used by commercial test strips.
In terms of intellectual property, it is possible for us to file for a process patent in the future if the stamping process proves to be successful when we're on the ground this summer.